Talk to us exactly the significance of what we think has been stolen here.
OK, so on June the 3rd, cyber attackers thought to be a Russian gang called Quilin hacked into an NHS digital pathology provider. So this is a contracted out service where this Synnovis presents digital pathology results to hospitals and GPs across the southeast of London. So we're talking about tens of thousands of patients. You take a blood test, your GP sends it off. Within hours, minutes, days, it's sent back to the GP, all done digitally. The NHS was unable to provide this service. It causes huge disruption. Thousands of patients were affected. Over 2,000 appointments had to be cancelled. Over 1,000 operations and procedures were cancelled. And it's months of disruption. This is all done to extort money from the NHS. So these criminal cyber attackers want money from the NHS provider and say, look, we've got your data. We'll give you back your data if you give us a lot of money. It's probably understood that the NHS provider, acting under the guidance of the National Cyber Security Centre, didn't pay the ransom. And that's why we've seen up to 400 gigabytes of data published on their Telegram and dark web sites. We can't verify that. The NHS says it's working to understand what is being published, but that would be names, addresses, dates of birth, national insurance numbers, NHS numbers, and potentially blood tests as well.
Is the kind of issue that this caused that it was going to delay many things taking place in the NHS, and thus maybe the NHS would want to pay the ransom, or that this data is so personal that to have it out there at all would be hugely costly? I mean, clearly it's a breach of privacy, but it's not. Doesn't sound like data that you could sort of threaten individuals with to say this will humiliate you. I mean, blood types and the like, or could it?
Potentially. We don't know what information they have. So I would say to you, Wilfred, that it's both. It's to cause mass disruption, to expose breaches in the NHS's cyber security. And if you're a patient, would you want your information out there in the public domain? You wouldn't. I mean, we all feel completely violated if our Facebook pages are hacked. Mm-hmm. If somebody said to you, you're undergoing medical treatment and your medical test results could be given out on a platform somewhere for other people to know. This is highly personal information which you wouldn't want to share with anyone else. And the fact that it hasn't been protected, the NHS must ask itself questions about its own cybersecurity systems, which when I speak to people who are experts at this, say health systems across the world, and we've seen it already happen in the United States, are particularly vulnerable.